Happy 2025. Will this be the year that Washington State finally advances their agenda to have school-based healthcare in all areas of Washington? Almost certainly it will. Hey there, I'm Julie Barrett. I'm the founder of Conservative Ladies of America and Conservative Ladies of Washington, and I'm back again with another bill of the day. Well, Happy New Year. It is January 2nd today, and the Washington State Legislature will kick off its 2025 session on Monday, January 13th. And so, as you know, our team has been working hard for the last month to prepare for the upcoming session. We've been watching a lot of the pre-filed bills, and we have a whole playlist full of Bill of the Day videos that you can go back and watch and get up to speed. Today, I'm going to talk to you about Senate Bill 5126, which was just pre-filed on New Year's Eve. It was the last pre-filed bill of 2024. And Senate Bill 5126 seeks to expand Washington's mental health care in government schools. So 5126 is sponsored by Senator Tawana Nobles and Cortez. I'm not sure who Cortez is yet. That's a newly elected Democrat in the Washington State Senate. It is also at the request of the Washington State OSPI. That's the Office of Superintendent of Public Instruction. That is Chris Reichdahl. Now, this is an act relating to establishing a statewide network for student mental and behavioral health to maintain, expand, and provide oversight to Washington's school-based mental and behavioral health system for children and adolescents across the state. This has been a huge push, not just in Washington, but around the country. You may have heard about the CDC's whole school, whole child, whole community model. It's for short, it's WSCC. And essentially what their goal is to make schools one-stop shopping, not just for the students, but for the community at large. So even parents and adults who may not have kids in school. This is the ultimate goal with these school-based health centers and the whole school, whole child, whole community agenda. We've already done a number of videos on that WSCC agenda, and I will link those for you in the description as well. So you can go check those out and go down that rabbit hole for yourself. But today, let's get back to Senate Bill 5129. Currently, Washington has 69 schools in the state that have school-based health centers. Now, this is an agenda that has been going on in the country for a very long time. I believe it was Lyndon Johnson who first initiated this campaign to have healthcare integrated into the school system. And of course, it wasn't an original idea of his. No Democrat ever has an original idea. They always hijack it off of somebody else. So this came from other countries that are doing these more community-based health services and incorporating them into the schools. In 1985, there were 35 schools in America that had school-based health centers. In 2021, there were 3,900 school-based health centers in schools across the country in 49 states. And this is a big agenda. And there's a lot of federal funding for these types of programs. A lot of these school districts are able to get federal grants to support these types of programs because there's just not enough funding in the state. And with the Biden administration, they added substantial amounts of funding for these programs, a lot of it under the notion of supporting the LGBTQ students in our public school system. So let's take a look at this bill and why it's bad. Well, first of all, in Washington state, parents do not have access to their child's mental health records. You might have heard about Initiative 2081, which is kind of referred to as the Parents' Bill of Rights, which was a citizen initiative that was passed by the legislature in 2024. Now, as soon as it got passed, and our whole team was skeptical about why were the Democrats voting to pass this? Well, if they voted to pass it, then they can come back the very next session and repeal the pieces of it or all of it that they don't like. And in June, the ACLU and some other groups filed a lawsuit to challenge I-2081, and a judge halted many pieces of the initiative, and one of those parts being the mental health portion. And the OSPI, Chris Reichdahl, who I mentioned a couple minutes ago, sent out a newsletter update back at the beginning of November, where he said, well, I 2081 does require release of education records that may include a student's sexual orientation. Any such records that are mental health or medical records may not be released under the current injunction. So we know that, I mean, this is Washington, you know where this is going. This thing is going to get repealed, or they're just going to pull out the parts of it that they don't like. So currently, parents do not have access to student mental health records. That's a huge problem. That's out of the gate. That's the biggest problem with this bill, is that they want to push in more mental and behavioral health supports, and parents also don't get access to those records. So huge, huge red flag number one. Senate Bill 5126 would provide support from interconnected community settings. Now, what this means is they're going to connect with other youth services that provide access to protected healthcare. They might provide housing. They even provide legal services to children. And I know this because it happened in my family. There are several groups that provide legal services to children who would like to be able to do certain things without the consent or notification of their parent. And Washington Democrats are very much on board with these kinds of policies. So the goal behind this bill is to provide all mental health services to children through the public school system. Schools should be about providing an academic education to the students. And we know that Washington, along with many other states, schools are failing to provide students with a basic academic education. Students in Washington state are massively failing. As of the latest report card from spring of 2024, only 50.3% are meeting basic standard in ELA, English Language Arts. 39.7% are meeting standard in math, and 43.5% are meeting the standard in science. They are failing to do their job to educate the students and get them ready to have life beyond school, to be independent adults. And the fact that they want to push more mental health stuff into schools, they've been doing this for decades, right? They've been pushing mental health into school for decades and really ramping up in the last 5 years, especially with COVID. And what we're seeing is the mental health of the students is getting significantly worse the more of these services that they push into schools. So the bottom line is these services, this agenda is not working for our students, and it is in fact creating a mental health crisis for our kids. This does not belong in schools. So they're also going to be conducting more screening. They're going to be gathering data on your kids. The bill also says that they will be delivering and supporting the local education agency in adoption and development of mental health and substance use classroom education, inclusive of prevention topics such as opiates, vaping, and mental health promotion. They're going to push it into the classroom. They're going to push it onto the teachers to provide this information to students. These are teachers. They're not mental health professionals. They didn't go to school to be mental health professionals. They've also got a clause in here where they're going to support behavioral health career pathways through hiring new non-licensed staff. So I'm guessing that they understand that there's a shortage of workers for this. So they're going to hire people who aren't certified, maybe aren't even qualified, and then they will get them up to speed. The way it works in Washington is they will hire a bunch of woke, radical leftists, a bunch of DEI people, and get them trained the way they want them to be on this whole mental health agenda. As with many bills, this is not the first time this bill has been introduced to the Washington State Legislature. It was introduced during the last session in 2024. It was Senate Bill 6216, which was sponsored by Senator Tawana Nobles again, and it had a number of other co-sponsors. Two of those co-sponsors were Republicans Nikki Torres and Jeff Wilson. So we are hoping that with this new bill in 2025, it will not have any Republican sponsorship or support when it comes time to do a vote. Yeah, they can pass it anyway because they don't need Republican support to pass their bills, but we really hope that Republicans will make a statement saying this does not belong in schools and they will not support this bill. Now, last session, when this bill had a public hearing in the Senate K-12 Education Committee. Joy Joyjald, the programs director for Conservative Ladies of Washington, was one of only 2 people to testify against this legislation. And here's what she had to say.
My name is Joy Joyjald, and I am speaking on behalf of the Conservative Ladies of Washington. We are exceptionally concerned by the continued focus of state-sponsored mental health care being administered through our public school system, and we strongly oppose Senate Bill 6216. This bill expands the depth and breadth of accessibility through our public schools while deliberately driving a wedge between children and their parents. This makes it increasingly difficult for parents to be involved in and to be a contributing part of the health and well-being of their children. I know firsthand. When my daughter's teacher found her suicide plan, which included a date and the method in her ELA notebook, no one called that in, as per Washington state law, as a mandatory reportable. We saved our daughter, not the schools. Students are failing in Washington state public education. If they fail, it impacts their self-esteem and their self-worth, which impacts their mental health. Thank you.
So many parents have a similar story to Joy and her daughter's story. And this is a huge problem that we're seeing across the board. And the schools want to cut the parents out because the school believes that they know better than the parents do. And this is a huge problem. And this is creating a huge crisis for our children. Children have a divine right to the protection by their parents. And this bill does not allow that. This bill will cut out parents and further alienate children from their supportive parents. So we are a huge no on Senate Bill 5216. We hope you will join us in standing against this. As I said, Joy was only one of 2 people who testified against this bill. There should be a line of parents and concerned citizens out the door to testify against garbage policies like this. So please consider getting involved in the work that we're doing. You can visit our website, conservativeladiesofwa.com, and just fill out that pop-up on the first page. And in the notes box, just let us know that you're interested in helping with our legislative action team, and we will connect with you and get you plugged in so that you can go to work with us, either in an upfront position where you're testifying on legislation, or maybe you want to work behind the scenes and help us dig into this legislation. We need all the help that we can get. We really need to build our army. Please don't forget to share this important video with your friends. Make sure that you are subscribed to the channel. Make sure that you have turned your notifications on, because once this session gets started, we will have a lot of time-sensitive video content that you will need to respond to. Make sure you're also subscribed to our Substack, where you will get the latest breaking alerts and calls to action as we go throughout the legislative session and beyond. If you would like to support the work that we're doing, there's a donation link below, or you can tap the thanks button right down below the video and chip in a few bucks to help with our movement. All of this takes a ton of time, a ton of work, and financial resources to make all this work possible. So we appreciate you watching. Thanks for subscribing, and I look forward to seeing you again next time.